Hello, I'm Dr. Clint Sexton, and you are on the IBS page of our website. So I wanted to create a video to talk to you just a little bit about the condition and some of the things that I look for and causative factors that can contribute to this particular issue. So first of all, it's IBS, so Irritable Bowel Syndrome. And so the word irritable means, well, it's unhappy, not a very medical term to use. So basically that means we're not really sure what causes it, and it doesn't have a single cause. So a lot of we want to look at with this is just what's going on in terms of what you're experiencing. So with IBS, you'll often have bloating and cramping and pain, maybe loose stool, maybe constipation. So this is a functional disorder of the gut. It's not something you're going to diagnose or identify with a colonoscopy or endoscopy for that matter. It's not something that you would test for that way. It means that the combined harmonious functions of the digestive system are not working properly. So that's why it's an irritable bowel syndrome. Okay? So let's talk about the three major systems that would influence this. So with a lot of the issues with the condition, it's going to affect what's called motility, which means how quickly or how slowly things pass through the bowel. When things pass through the bowel quickly, that would give you loose stool and urgency and frequency of bowel movements. Constipation would slow down the movement of contents through the bowel, and so the motility is controlled by the nervous system. So that's the first system we consider. Okay. Now another system we have to consider is the endocrine system. Now that is your system that contains your hormones. And really we're talking about hormones more along the lines of things like estrogen or progesterone or testosterone. For example, more women tend to have problems with IBS than men do. So we know there's this hormonal component to it. And these IBS symptoms can begin at different points of hormonal stages in life or the use of hormones. For example, beginning of menstruation can initiate problems with this. Or another shift in hormones, such as reaching perimenopause or menopause, or taking birth control or other hormones. So we know that the hormones also play a role in this. The hormones are also going to have an impact on how the nervous system of the gut works, okay? And it's also going to affect the third system I'm going to talk about, which is the immune system. Okay, so most of your immune system is located in and around your gut as well. And things that are going to affect the immune system would be things like diet. So you could have things like diet, you could have food allergies or food sensitivities. I'm also going to include the gut microbiome. So we're talking about all the different microbes that live in the gut. So if we have an imbalance of yeast or bacteria or parasitic issues, anything like this, that's going to have an impact on the immune system as well. And so we have three major systems we're talking about now. So it was the nervous system, the endocrine or hormone system, and the immune system. So I'm going to just touch on these one more time and connect these a little bit. So your gut has its own nervous system. It's called the enteric nervous system. And there is also a connection to this gut system with your brain. So there's a brain-gut connection. And one of those connectors it would be a nerve called the vagus nerve. So there's a nerve that runs up from your brain and goes down to your digestive system. So that's one aspect of this connection, okay? So when we're looking at the nervous system, there's lots of things that could influence that, such as stress could be a factor, imbalance of what we call nerve chemicals or neurotransmitters, things like serotonin or dopamine. So we just want to think nervous system, okay? So then when we talk about the nervous system and the endocrine and hormonal system and the immune system, these are your main regulating systems of the body, okay? Not just in relation to IBS, but in many, many different conditions. These are the main regulating systems that your body uses to keep everything working properly. So these are the systems we want to assess and evaluate with IBS. So with different testing that we can do and through the process of consultation, we want to find out how many of these three major systems seem to be involved, how are they contributing to the problem, and then what can we do to bring those back in balance. Okay, so I hope you found this helpful and kind of take a very complicated subject. Let's getting it narrowed down to three major systems and how those systems are related to each other and how they're going to contribute to this particular condition. So if you'd like some more information on this, there's some more data on this page here that you're on, but there's also lots of blogs on our blog page that will also talk about IBS. I hope you found this helpful. Thank you.